Your physician prescribed a medication for you that should be inserted vaginally. Vaginal preparations can come in several different dosage forms, which may include vaginal creams, vaginal capsules, suppositories that are inserted vaginally, or mini inserts and mini suppositories. Regardless of the dosage form, they are all inserted in a similar fashion. Always be sure to wash your hands before applying vaginal preparations to decrease the chance of contamination. It is also good to empty your bladder if you can before inserting. This will minimize the chance of the medication leaking out should you have to use the restroom after inserting it. You should already have your vaginal applicator loaded with the medication, or you may be using your finger. If you're unsure of how to load your vaginal applicator, see our supplemental videos on loading your devices. Step 1. Relax while laying on your back on a flat surface with your knees slightly bent. Alternatively, you may stand up with one foot propped on a chair. Hold the applicator with one hand and slide into the vagina as far as comfortably possible. This is the same motion as inserting a tampon. Stop when the applicator will go no further or you feel pain. At this point, place your first finger or use a finger from your other hand to push the plunger into the applicator. This will release the cream or suppository into your vagina. Slightly twist the applicator as you slowly remove it so the cream can adhere to the vaginal wall. If you are using your finger, insert it as far as you can comfortably and slowly twist your finger on the way out so the cream can adhere to the vaginal wall. A good rule of thumb to remember is that 1 gram is about a thin line of cream, the distance from the crease in your first finger to the end. This will help give you an idea of the size of 1 gram. Of course, this is not a perfectly accurate measurement, but it helps if you prefer to use your finger to apply the medication or if you lose a vaginal applicator. So this is about 1 gram of cream from the crease to the tip. It is best to lie down 30 minutes to 1 hour after inserting the medication so it can properly absorb into the vaginal canal. We advise that you refrain from sexual activity for 4 to 6 hours after using the medication, so it will have the best chance of helping you and so there is no transference to someone else. Remember to wash your hands and the vaginal applicator if you are using it with warm soapy water and lay out to dry.